For this week's Therapeutic Thursday, we are learning about the recreational therapy services offered at Pinnacle Pointe Hospital. So joining us is Corey Jones, the director of the program, and Marissa Hammonds and Santana Manry, who are therapists there. Thank you all so much for joining me today. Corey, my first question are just kind of explaining what are the requirements to become a certified therapeutic recreational therapist?
Yes, well, the requirements to become a certified therapeutic recreation specialist are there's educational, there's experience, and then there's examination requirements. And those are set by the National Council for Therapeutic Recreation Certification. As far as educational, you must have a bachelor's degree or higher from an accredited university. And then also, you must have a field placement. And then lastly, you must pass the national examination.
So, Santana, what is the primary goal of recreational therapy in a behavioral health setting? And then what are some of those activities that you get to use as intervention?
Okay, well, the primary goal of recreational therapy in the behavioral health setting is to improve our patients' emotional well-being, their social skills, and coping mechanisms. Recreational therapy at Pinnacle Pointe aims to provide structured opportunities for patients to engage in meaningful activities which can reduce stress, build self-esteem, and help them develop those coping mechanisms that they need. A couple of examples of our interventions that we use, we have community outings, where a popular outing is volunteering at the Arkansas Food Bank.
Nice.
We also go to Crystal Bridges Museum in Bentonville. We've been to Mid-American Museum in Hot Spring. We've also been to Blanchard Springs Caverns. We have pet therapy, where we have two amazing teams from Able Paws that come and visit our patients at least once a month. And fitness is also a primary goal for Pinnacle Pointe, to keep all of our patients engaged and physically active. We have a on-campus swimming pool during the summer. All patients get to rotate through and engage in swimming all summer. We also have a campus gym where most of our activities are conducted there. And we also have in-house special events, where our last one was our Halloween carnival. We had a bouncy house, snacks, popcorn, music, and it was just a really good time for everyone.
What I'm hearing here is there's no shortage of recreational activities. I mean, you keep them busy for sure. Marissa, kind of explain, how do you assess a patient's needs and interests?
So we conduct assessments that include interviews, observations, and standardized tools, and it helps us identify the patient's strengths, their challenges, and their interests. We also collaborate with the treatment team to ensure that the therapy aligns with their treatment plan and their overall goals.
Sure. Santana, kind of describe a typical session or activity that you might lead.
Okay, well, a typical session would be a group-based setting. Music appreciation or karaoke are some of our popular activities that we do implement. For example, if I was to lead a music session where I would be aiming for the patients to express their emotions through song and dance, and following the end of the activity, we would have a discussion over any of the themes that we may have seen throughout the activity, and possibly how the songs made them feel, and any kind of coping mechanisms that they can use from the karaoke session.
Marissa, can you explain how you would measure that success that recreational therapy is working for someone?
So progress is usually measured through increased engagement in activities and behavioral changes, and also patient feedback. An example would be a patient might demonstrate improved social interaction and reduce anxiety that they had upon admission, and the willingness to try new activities. We document and observe and share them with the treatment team also.
Corey, how can someone reach out, or if they just want more information about Pinnacle Pointe Hospital?
Yes, Pinnacle Pointe offers a no-cost health assessment 24/7 by a licensed professional. Call us anytime at 1-800-880-3322 if you feel your child or teen is needing acute care from our hospital. Now, if the need is not immediate, but you worry that your teen is facing anxiety or depression, our team can make referrals to outpatient clinics across the state.
Perfect. Thank you all so much for joining me today. I really appreciate it. And viewers, I do want to let you know that we are taking your questions for our panel to answer every single month. All you have to do is email tt@katv.com. And we'll have more Channel 7 News after the break.